Okay.
Okay,
All
you
right.
will skip the other one. Okay.
Have fun.
If you're ready, give me the sign, Jean-Pierre. Okay? Good.
I'm ready.
So I will count 5 and then I will start. Because we have pre-recorded intro and outro, we will directly go into the question after 5 seconds.
Okay.
For today's episode, we have invited Jean-Pierre Girard, lecturer of University of Quebec, Montreal, who contributed to the encyclopedia, an entry on health and care sector and the SSE. Jean-Pierre, thank you for joining us today.
It is my pleasure.
Could you briefly introduce, sorry, I will do it again. Could you briefly introduce yourself for our listeners?
Yes, of course. Well, 40 years ago, I completed a master's study in co-op management over here in Sherbrooke University, Canada. Since that time, I always work in SSC from various positions, not only in Quebec, but in several regions, including Europe and Africa. So I work as executive director of a co-op confederation, researchers, teachers, writers, consultant, key speaker, board member, which includes sitting 12 years on the board of International Health Co-op Organization, which is a sectoral organization of International Cooperative Alliance. Apart my contribution to the International Encyclopedia, recently I wrote a book celebrating the 100 years anniversary of Sugyo Co-op Group, which is the biggest Canadian agri-co-op organization with an annual turnover of close to 9 billion Canadian dollars.
Excellent. I hope great success for that book.
Thank you.
With that. Okay, you are an expert on health and care issues. And how did you become interested in the SSE?
Well, the answer is very simple. I find some opportunity over here in Quebec to set up this kind of co-op, I mean health cooperative, in the face of lack of services. And starting from ground level, I developed some interest at the Canadian and then at the international level, getting involved with the 1997 United Nations worldwide study about health and social care in health. In health, and I'm sorry about that. I need to repeat.
Okay, we will do it again.
Okay.
So after 5 seconds, I will ask questions and then you will do it again.
Okay, sorry. Okay?
You are an expert on health and care issues. How did you become interested in the SSE?
Well, I already have some background experience in co-op model in other area, housing, workers co-op, and so on. And over the time, over here in Quebec, I find some occasion to develop or set up health cooperative based on ground needs. So starting from local activities, I develop interest at the Canadian level and then at the international level, getting closely connected with the United Nations during the time. They conducted international survey about presence of health cooperative. So since that time, I always have interest to explore more in detail the place of co-op, mutual, and association in health and social care.
Why do you think the SSE is quite important to health and care issues?
Well, when you look carefully the situation of health and care issue, you find many problems, including the question of access, the question of quality of services. So I think the SSC model can be a very value-added model to improve services, to improve quality of services all around the world, in different regions of the world. And what is interesting is the fact that we find different ways to apply the model. For in some countries, we have a producer cooperative or doctors cooperative. In other countries, you have user or consumer cooperative. And even you will find also what we call multi-stakeholder cooperative. So a kind of co-op gathering different kinds of members. So as a users, as a worker, as a health professional, and so on. So we have this very impressive capacity of the model to be adapted to different situations.
You wrote an entry on health and care sector and the SSE for our encyclopedia. What messages or key points you wanted to share with the readers through that entry?
Health and social care is a very important component of our society. And when we look very carefully the way we lead or manage this sector of activities, too often we simply forget the contribution of the SSE model all around the world, not only in North America, but also in Europe, in Africa, in Asia Pacific region. So my simple message is promoting more and more the value added of the SSE model in health and social care. And in addition, of course, we need more and more relevant study and report about these contributions, because I need to recognize this is a missing point. We don't have enough study that show this contribution of the SSE model in health and care sectors.
Sorry, Jean-Pierre, I mean, there was a kind of audio problem during the recording for the last question.
Okay.
Jan?
Yes.
Jan?
Yes.
Yeah, we had a problem, right?
Just a small interruption, but I think we can try to do the questions again, and maybe Jean-Pierre, because you have 5 minutes, perhaps you can also maybe elaborate a bit on the answers.
Yeah.
Okay, I have enough time.
Again? Yeah.
So I will ask that question again, and Jean-Pierre, you can answer that question again, right? About entry question. Okay.
Perfect.
After 5, I will make question to you. You wrote an entry on health and care sector and the SSE. What messages or key points you wanted to convey? Okay, I'll do it again.
Take your time. We're not on the rush.
Yeah. Okay, I'll do it again after 5. You wrote an entry on health and care sector and SSE. What messages or key points did you want to convey to the readers through that entry?
Yes, a very simple message. When we think about the place of health and care sector in all our society in north, south part of the world, we need to recognize the importance of this area of activities. And then when we look more carefully, it's very often the same problem. The SSE contribution to health and care sectors is simply underestimated. Why? For many reasons. Sometimes we don't have a good legal framework. We have a misunderstanding of the contribution of this model. So my message is simply trying to have a better comprehension of the value added of this model. For instance, when you look carefully the case of the health sectors from a worldwide perspective, we can see a variety of co-op model. For instance, in Spain, in Brazil, we have a doctors co-op. In Japan, we have user or consumer co-op. Over here in Canada, we have multi-stakeholder co-op, which means a place in the governance framework for the users, workers, and support members. In other words, when you see this adaptation capacity of the SSE model, it's easy to connect with the lack of services in the health and care sectors. But moreover, based on the experience that we have identified over the 25 last years, we can see the very impressive innovative capacity of the SSE model. Innovative in terms of quality of services, innovative in terms of access to services, innovative in sense of empowering women. So we have all this contribution of the SSE model that we need to keep in mind when we think about a way to shape our health and care sectors.
Thank you, Jean-Pierre Girard, for being with us today.